Troubling situations from top to bottom. The coronavirus is eating away at valuable resources tonight.
From schools to hospitals, we are at a critical stage. In the last hour, News 4 confirming Jennings schools will be going all virtual. That begins on Monday. The superintendent telling us virus cases are out of control and staff is fatigued from trying to prevent spread, that kids will remain virtual until at least January.
New tonight, the death toll in America is now cresting 250,000. The pictures you're looking at here are from El Paso, where trucks are being used to store bodies because people are dying so rapidly. Also new tonight, Columbia University scientists say data now suggests more than 3 million Americans are contagious with the virus.
The hospitals are cracking with conditions deteriorating by the day. A record 841 in St. Louis are hospitalized tonight with the virus. Nationally, more than 76,000. Hospital staff is being worn to the bone.
Yeah, there's a new term for that. It's called COVID-19 burnout. News 4's Ashley Lincoln is learning what St. Louis hospitals are doing to help the medical staff we cannot afford to lose. Ashley.
That's right, Samantha. We found out that there are two main factors in this situation. The first one is the volume of COVID patients that are being admitted into these hospitals. And the second factor is the length of time our medical professionals have been battling this pandemic.
It's hard to maintain your physical well-being when you are just emotionally spent.
It's a constant wall of pressure.
We are under a lot of stress.
Nurses and doctors all over the metro say they're dealing with.
I don't know how much more they can take on, but I know one thing, they're providing the best care to our patients.
Top medical professionals telling News 4 they're working to prevent employees from experiencing the COVID-19 burnout.
It's the physical stress, but it's really the emotional stress of watching patients and families go through everything they're going through.
Mercy's leaders say physicians and nurses are battling the overwhelming number of cases, mental and physical stress, along with coping with coworkers who have contracted the virus. According to the National Nurses United organization, 1,700 healthcare workers have died of COVID-19.
The difference here is really the length of time we're dealing with this type of pandemic.
It doesn't seem to be any end in sight.
Kathy Bonser is Regional Chief Nursing Officer with SSM. She says she's felt fatigue since August.
I really just hit the wall mentally. I was reaching for any sort of support that I could find.
SSM and Mercy have created programs providing services with mental health professionals. SSM is offering holistic rooms for meditation, and Mercy's leaders have provided access to a mental wellness app.
That's really helped our physicians, which, you know, they're a strong bunch, but they are feeling the effects of this as well.
Both Mercy and SSM say they're looking for long-term mental health solutions to make sure staff is adequately equipped mentally to handle the stress.
There still is fear, just because there's so many unknowns.
And medical leaders also tell us that their message to the public is for individuals to continue to practice social distancing and wear your mask. And Samantha, the good news here is that both Mercy and SSM, they tell us that they have not had a high turnover with nurses leaving. They tell us the main reason that people do leave is because they're entering into early retirement.
Ashley Lincoln live for us in Midtown. Thank you.